start off our next panel, we're going to play a brief clip from Stephanie's and Mr. Davis's award-winning play, Forget Me Not.
So this is going to be our participatory part. We've been sitting for a long time today. Before I introduce our panel, let's take a few minutes, and I want y'all to throw out some words that you think tell me what community engagement is. We've been talking about it a little bit last panel. Let's hear it.
Entrenchment.
Entrenchment. Okay. Yeah.
Establishing trust.
Establishing trust.
Transparency.
Okay. Transparency.
Listening.
Listening.
Intentional.
Intentional. Good.
Accountability. Accountability.
Hearts and minds.
Okay.
Asking.
Asking. Vanessa?
Understanding culture.
Understanding culture. Yes.
Commitment.
Commitment. Okay. Anybody else? Come on. Start.
Respect. Respect.
Respect. Yes.
Relatability.
Ah, relatability. Okay.
Speaking the same language.
Speaking the same language.
Collaboration.
Collaboration. Ian.
Giving, not taking.
Giving, not
Yes.
taking. That's great. Give yourselves a round of applause because fantastic. So that's what this panel is going to talk about today is community engagement, something that we all need to learn, some different tactics and different tools. But we always want to start from being intentional about it, which means wherever you are, think about what does this mean? Think about those words that you heard. And so the activity that you're seeking to implement or the communication that you're trying to send out to the community, it needs to be about those things that we heard. We use the Forget-Me-Not as a method of reaching audiences. But there's a lot of things that happen before we bring that method, that tool, into a community. There are ongoing relationships that have to be forged. Hopefully they become a permanent relationship because we're trying to build trust in the community. We want to find partners there. We don't want to parachute in an idea. We want to make sure that we have buy-in and enthusiasm from the community and that it's meeting their needs. And so we're going to have to be flexible in terms of what we do. We're going to develop those relationships because relationships are really the key to anything that you do. We're going to work together as a collective to apply collective vision. So it's not just going to be my idea or Us Against Alzheimer's idea or Pernissa's idea or Ian's idea. It's got to be a jointly developed idea that we're going to try to carry out. It's what you say, it's how you say it, it's who says it, and it's who you say it to. And that all needs to be part of what it is that you're going to implement to do this thing that we call community engagement. And so today I'm distinctly honored to turn to our wonderful panel of individuals who have their own unique experiences and tools that they'd like to share with us about how they have engaged communities. So we first have Pamela Price, who is director of the National Brain Health Center for African Americans, and she works with the Balm of Gilead Incorporated. Then we have Adriana Perez. She's a visiting professor at the University of Pennsylvania School of Nursing, assistant professor at Arizona State University College of Nursing and Health Innovation. Garrett Davis, president of the Forget Me Not Project, and many other hats that he wears along the way. And Ashley Shaw, associate director of the African American Brain Health Initiative at Rutgers University, Newark. So let's give our panelists a round. So let's just start this conversation with you, Pam. Tell us a little bit about what's happening. First of all, tell us a little bit about the Balm of Gilead, and then very specifically about the National Brain Health Center for African Americans.
Thank you, Stephanie, so much, and for George for having us be a part of such a wonderful event. So the Balm of Gilead was really fortunate and excited to be able to launch our National Brain Health Center for African Americans this summer. And it came out of our, or being a recipient of a CDC Healthy Brain Initiative. So we are one of 2 grantees this year that will continue their Healthy Brain Initiative work and their work with their roadmaps and engaging not only now local and state health departments, but really looking at how do you take the work that they started on the last round and really getting it out into the community, which is where the Balm of Gilead plays a very crucial role. As an organization, we, for almost 28 years now, have really focused on engaging the faith community to address health disparities. So originally with work in HIV and AIDS and really taking that foundation and that framework and now being able to take education and awareness and really looking at even programs and interventions that will address Alzheimer's disease and other cognitive health issues in a way that is very specific, that is culturally appropriate, and really looks at how this disease is impacting African Americans. We've heard about the disparities, we've heard about the different challenges that each of the minority communities are facing. And so the Balm of Gilead really understands the role of the faith community and understanding really what that relationship has been. It's been a constant in the African American community and in African American families, and really wanting to utilize and harness that power and that voice of the faith community to really address the hard challenges such as stigma, the trust issue, the discrimination that unfortunately is still occurring, and really doing it in a way that is not, that really goes beyond the education, it goes beyond the awareness, but really in looking at program design, implementation. It's that pull through, bringing that bridge between health disparities, public health, science, and faith, and really bringing it all together in a way that is, again, relative and appropriate. Just understanding, we have been doing trainings with chapters of the National Black Nurses Association. And so even healthcare professionals, such as our nurses, are unaware of how Alzheimer's and cognitive health issues are impacting families, how it's impacting caregivers, and really just understanding what the disease and where it has been and where it's going. So we know that there's a lot of work to do even at the community level, and again are really proud to again be a part of this event and look forward in terms of continuing to partner with Stephanie and Us Against Alzheimer's.
Great, thank you so much. and we'll come back to you in a second. Did you wanna go through your slides when we
Yeah,
come back?
yeah, there was two more, I just wanted to,
Okay.
point out, again, so, our conference, and again, because we're really big on equipping our churches, equipping our ministries, equipping our pastors in terms of doing this work. Not only, is it important because it gives them the ownership of what they're doing, but it also helps with sustainability. So we, have our National, Healthy Churches 2020 conference. This is our third year that we're doing it, and again, this conference provides an opportunity really for hands-on education, hands-on information, and hands-on skill building for the faith community. Again, it brings together science, it brings together public health departments, really in a 3-day event that allows churches to be able to go back and effectively implement programs and services to address health disparities in their communities. And then wanted to also make sure that everyone had an opportunity, again, as we just launched our National Brain Health Center for African Americans, to definitely join us on social media. As we know, this is a big platform now, and it's a big opportunity to engage individuals. We wanted to make sure that you took an opportunity to follow us on Facebook, on Twitter, as well as taking an opportunity to check out our website. You can find information about the conference as well as the brain health seminars that we're doing with our partners at the MBNA.
Wonderful, thank you so much. Adriana, if you want to speak for a few minutes about what it is that you're doing, research that you're doing?
Yes,
How you
thank
engage
you.
communities?
Yes, thank you. I want to thank Jason for inviting me to be part of this awesome panel and participate in this summit. I'm learning so much, and I have to say I really appreciated the conversation earlier about junior faculty. I actually moved from Arizona State University to the University of Pennsylvania, and I've been at ASU my entire academic career, and never thought I would move, but just being at Penn was a great opportunity, and this, I think, allows me to test my work in a different setting, moving from the Southwest to the East Coast and surviving my first winter has been a real experience, but a great challenge, I think, and overall, a mentor of mine said, why won't you leave Arizona? All my work was in South Phoenix, and I said, that's my community. I think a lot of times minority faculty, especially junior faculty, feel very connected to the community where they work. I mean, I'm from the community, so this is something very personal to me. And she said, she really wanted me to move to Penn, and she said, I really want you to think of this country as your community, and this world as your community. And so that really, having mentors like that makes such a difference for junior faculty. And so the current study that I have is a study funded by Rickmar Center, so I do want to thank the National Institute on Aging at UC Davis. And it's focused on cognitive health and physical activity in older minority women. I started in Phoenix working with a community focused on older Latina women, and the entire process took about 4 years of using community-based participatory research. So I just wanted to share some pictures, and I can come back when we talk about our toolbox, but I just wanted to share some pictures about the kinds of things that I have found helpful both as a scientist and also as a nurse practitioner seeing patients, and how you approach problems, whether they're research problems or clinical problems, to really involve patients, involve families, involve participants as part of that process. I think we're trained to look at problems and address the problems, but when we don't look at the strengths and sort of that other side of the person and what they contribute to the relationship to research, I think we miss the other half of the picture. And it is a challenge in terms of grant writing, because through the work that I've done, I in Phoenix developed helped to found. I was one of the founders of a community advisory board, and they were part of an entire research application looking at cardiovascular health and cognitive health outcomes in the community. And a lot of the recommendations that they had for the proposal, me and my colleagues at Arizona State knew that they would be a challenge in terms of having all of this reviewed. And sure enough, we came back, and it was hard to try to balance what the community wanted versus what reviewers at the National Institute of Nursing Research wanted. And so I do have to share that, that is a challenge that we have to think about. And as we were earlier, the discussion, what can we do to promote new scientists and especially scientists of color? I think that sometimes, review panels might benefit from having just a young scientist, maybe not someone as established, but just to be able to provide the feedback and just sort of a diversity of thought in what goes into a review. So I'll come back and talk about the things I need.
Perfect. Garrett, tell us a little bit about Forget Me Not and why you decided to use the arts as a way of educating people.
It was not my plan originally. I'm a grandmama's boy, the oldest of 23 grandchildren. And I went home from spring break and my grandmother didn't know who I was. And I didn't know how to deal with that. And that's why I resonate with you, Malcolm. And I applaud what you're doing. I didn't have the nerve to do it then. And so when my grandmother died, my sisters and my mother and my aunt would tell me that goodness would ask about you. Her name was Goodness. And so I decided to write a play called Forget Me Not to bring closure in my personal life. It wasn't about her, it wasn't about us, it was just to bring closure. Little did I know that play would impact so many. And so we started touring the country doing Forget Me Not. And in Washington, D.C., in Howard University, I met Stephanie Monroe. And she introduced me to George Rayberg. And Forget Me Not started its national tour about 4 years ago. From that tour, I met someone from the American Diabetes Association and AARP. And so currently I'm touring 3 stage plays nationally. AARP backs Mama's Girls 1 on caregiving. The American Diabetes Association backs Mama's Girls 2, Sugar Ain't Sweet on diabetes. And UsAgainst Alzheimer's backs Forget Me Not. So my passion is to raise the awareness of issues and concerns that affect minorities with health through the performing arts, because I think we all learn differently. And we may never pick up the millions of dollars worth of brochures in a doctor's office because when we drop Mama off, we're calling Mama, we're saying, did the kids get to school? Did you call to know when we're late for work? We never pick up that brochure, but we go to a play and we see ourselves on stage. The next time we're in that doctor's office, we pick up that brochure. So I think theater has a powerful way of bridging the gap between what's out there and what we don't have. And a lot of times what we don't have, we just don't know it's out there. And so when they come to these stage plays, at the end of it, they're vulnerable. So they want to know, what can I do to help? Where is the information? So that's why collaborations are very, very important. And that's why I'm here. As I sit here and I listen to you all morning, it is my job to take what you have said and put it in a way that people can understand it on stage. And so it's not about the frustrations of being white and trying to get your colleagues to help you out. I'll put that in the scene. When you talk about, how I need help, I don't understand how my mother can do this. Well, I'll put that in the scene. And your stories will help people that you'll never even meet. And that's the power of storytelling. And so this is engulfed my life. This is all that I do. And so I started a program called We Care Try It. I live in the Greensboro, High Point, Winston area. And so I started a program called We Care Try It. And so I've gone to caregiver conferences, and Dr. Berg does an outstanding one. And so I was inspired for the one that she does to do one. But I want to do one that let caregivers just relax, relate, and release. When they come, they don't get lectured to, they don't get talked to, but we get to hear them. So we get to hear what is it that they go through, what are the frustrations that they go through. And they get, so they can hear other caregivers go through the same thing. So that's how they relate. They get to release, and then we give them massages and we do their hair. And so that sort of thing is starting to take off. So I'm always looking for innovative ways in the next partnership to take what we do to the next level and making sure to make your job easier. So the power of theater, Stephanie and George, has changed my life, and I think it's changed the lives of a lot of other people. The first week in November, Forget Me Not, we'll be shooting a pilot for a drama series. And so my next thing is to try to translate this into television. So thank you so much.
Wonderful, wonderful. Ashley.
Hi, I'm Ashley Shaw. I have with one slide.
There's the clicker here.
That's it. So hi, I'm Ashley Shaw. I am from the African American Brain Health Initiative at Rutgers University, New York, which is a university partnership, and so as the postdoc, who I'm the associate director and also like the postdoc, so I interface with basically every aspect of the program. The African American Brain Health Initiative actually started as just an outreach program from my PI, Mark Gluck, in the Department of Neuroscience, and then Dr. Diane Hill in the Rutgers University Newark's Office of Community Partnerships, which is exactly what it sounds like. So Rutgers University Newark is very focused on the community. And so we were very fortunate to have Dr. Hill, who grew up in Newark and basically knows everyone, and has sort of translated that into her career at Rutgers Newark, so having outreach programs. And Dr. Gluck, his specialty is in science, so for the first 8 years or so, they did several outreach programs. Some of them were big events on campus where people would come in and we'd have informational sessions. They've also done they actually have had caregiver support days, which not unlike what you mentioned, give some information, talk to each other. I don't know if they had people doing hair though, but I will keep just wait for the next time we do that. Yeah, I just didn't think that'd be great. And so our collage will sort of walk us through the top left photos of our community advisory board, which is comprised of us at Rutgers Newark, as well as people from churches, senior centers, and recently we've also started working with those from public and federally assisted housing in Rutgers, or at Newark, and also Greater Newark. The way I define Greater Newark is if you're not from New Jersey and someone asks where you're from, just go Newark, because they don't necessarily expect like Irvington or something like that. So from our surrounding communities, which are majority African American. The top right photo is from another one of our outreach programs. This one was also held on campus, which was Heart and Brain Healthy Soul Food Cooking. It was literally a cooking demonstration where we had people come in, and we worked with the American Heart and Stroke Association in New Jersey and we'll be doing that again actually now around between Thanksgiving and Christmas, to go, okay, so we know we're doing lots of cooking, let's have some like simple sort of changes we can make so the food is still good, but also healthy. But most of our outreach programs, and I'll take you to the left middle photo, happen at churches and senior centers, and actually within the housing complexes around Newark. So we do these smaller events where it's either a lunch and learn, or if it's sort of at tea time, we bring food, we talk. I give a short, sort of like 25-minute talk about like right now we're at like what is dementia, what are things that you can do right now to help mitigate risk. We talk a lot about healthy food and exercising and things like that. And so I spend a good amount of time in my lab, but most of the time I spend in Newark at the churches, at the senior centers, and at the housing complexes. We also have written materials, which I just put a little picture in to remind myself to talk about it. And in the past couple of years, we have, since I had showed up, the AABHI has started doing research now that they know us and they know that we're here for the long haul. We started doing research, and so we're focusing on cognitive health and exercise interventions, specifically Zumba, because, well, one, I am a Zumba instructor, and two, it is much more fun to dance. And also, this is Newark, so many of our adults, they may not necessarily feel comfortable doing a walking group, but they will come to a local church, a local senior center, or downstairs to the community room in the housing to get together and dance and still get those cardiovascular benefits. And then finally, the bottom row is our expansion of outreach. So on the left, we have what our ambassadors program, which we're trying to start with in conjunction with volunteers from the Northern New Jersey Black Nurses Association. They're already doing outreach work, and so we're working with them both because they're from Newark, and we want to keep as many people from Newark like in the lab, and also with our work. And then, so I'll stop there with that. And then in the center we have our scholars program. I know that was mentioned earlier, like how do you get young researchers in the program. So our Brain Health Scholars program is specifically for students from Newark who are interested in RA-ships, because Rutgers Newark is a very like medically focused, it's very like STEM focused campus. So there are plenty of students who want to do research, and it's very exciting for me to find the students from Newark who are like, I'm from here, I want to give back, and I also want to do research. So we work with them both to do the regular RA stuff and get those skills that go out and present. And so we have researchers, but we're also sort of trying to impart those community-engaged research skills as well. And we also have a Pioneers program for our Newark High School students who are already part of the activities in the with the Office of University Community Partnerships. So as part of their training, we just do STEM outreach. And I give them, when they work with me in the summer, I give them a crash course in psychology and neuroscience, and we tour all the labs on campus to go, okay, so one, this is what a science lab looks like. I apologize, it doesn't look like, CSI with, fancy screens, but the research is being done right here, literally, for some of you, it's like right down the street, so that they can see, one, how to become a scientist, because for me and my background, I didn't know how to do that, I just kind of became one. And then also sort of trying to entice them to do this kind of research, whether or not they want it at Rutgers Newark.
Excellent, so much need, so much need. So I love that idea about sort of demystifying.
Yes.
And demystifying research, demystifying. One of the things that we also do in the DVD version of Forget Me Not is we actually show people what it's like to go to the doctor. And we actually show, we have Garrett's character going to the doctor, receiving a diagnosis. You get to see some of the questions, because a lot of this, the reason people don't come in and don't volunteer for research or don't want to go to the doctor, they're so afraid, they don't know what's going to happen, when they're there. And so anything we can do to demystify that. I also loved what Garrett shared, some tips about things that we can offer to the community. So we don't have to build necessarily huge new programs. We just have to be mindful of what's happening in the community, what their needs are, and then fill that need. And if you fill that need, then you have the ability to have an audience, because you've done something that's legitimate. We also heard, and I want to hear a little bit more about the community advisory boards that both Adriana and Ashley, you spoke about, community advisory boards. That seems to me that would be really important. I want to know how you get people to serve on those. What is their role? Are they a permanent structure? How's the give and take with the board, and what your institutions decide they want to go forward with?
Sure. The one that I worked with in Phoenix was started from some of the federally qualified health centers and working with the community health workers, the promotoras. They were critical to that process and recommended certain community leaders, teachers. I worked with an urban planner to look at the environment, because I was very focused on walkability and issues related to neighborhood design. Faith-based leaders, businesses. We worked with businesses along a street to create safe routes to age in place. And in certain days of the week, the businesses came up with a business strategy to promote their own, business, whatever it is, that their business related to. But they did serve. There was a service commitment, at least in ours, for at least 2 years. Mm-hmm. And what's nice is that over time it became a community-driven board, and with someone, developing agendas, sending out meeting minutes and such. But having very specific goals and a mission was helpful to staying focused on the task at hand. And the community and the nonprofit organization that I worked with in the Community Health Center were really, they really wanted to bring in additional grant funding, and having at least one win would help the advisory board feel like we are making a difference. We applied for several grants, mm-hmm. but that was part of the outcomes we wanted to see, is that we would get together for a purpose, and we would be addressing the needs of the community. And through a series of community-based focus groups, health always comes up to the top. Some of my colleagues, clinicians, and researchers worry that, well, what if they address things we can't, fix or solve? But health is always a priority. So that came up for the board.
Absolutely. So I know from all the work that I do with Jason that for African American community, we really respond to churches. Mm-hmm. Going through that network of trusted leadership, community-based leadership, and trying to engage churches is really important. Latinos use a model, the promotores that you just suggested, which is a peer-to-peer. So I want to talk about those two different models. But with respect to churches, so tell us, How is it that you all are able to go into a place where you aren't currently based, right? From the church standpoint, black churches, not the easiest things to navigate, and get them to open the door and let you in and let you bring your messages into their church and have access to their people. How do you do that? What is that magic?
I think a part of it is really what you got to is that health is an issue regardless of where you are. And health is definitely on the minds of our faith leaders. And so knowing and coming in really with that mindset that it's not foreign, and I think sometimes that's a myth that you assume that that's not something that churches are going to be open to talk about, that they're not going to want you to talk about this or want to say you can only focus on this, health issue. But really, our approach is actually allowing them to tell us what their issues are. What are the things that they want to talk about? What's a priority for me? What's a priority that we're seeing in our communities? And then us coming together with them and allowing them to create and design a plan, bringing, having them understand that collaboration is really important, that not one church, one group can do and accomplish everything by themselves, but that together they're stronger. We do this through building healthy churches coalitions in different cities and different regions, so that churches together collectively are designing their own agendas, their own work plans, their own strategies. And we're really just coming in to assist them with the framework, to assist them with understanding how to evaluate the work that they've long been doing. But this, again, just gives them an opportunity to, again, take ownership of it, but also sets up for potential funding opportunities as well. And again, it's one of those approaches that we don't come in to get, from them. We're not saying we want you to complete this health assessment. We want you to do these surveys. So there's data collected, but again, they never get the data back. So by really allowing it and creating a partnership with them that is an ongoing partnership and knowing that that is our intentions up front really allows us to come in and create lasting relationships with the faith community.
Yes, we've been engaging churches. It's been surprising to me. I remember going at a conference in Baltimore of African American Baptist ministers, and I'm speaking and I'm following my script, and then I have to look up, and there were like tears being shed among the pastors, and I just sort of stopped everything because I'm sensing something's going on here. And as I'm sharing with them about things they can do to help their congregation, they in fact were processing that they might have Alzheimer's. They've got health issues. They see their colleagues who are in this leadership position, and because of that, they don't feel like they can be vulnerable and honest to even come out and get the help that they need. Same experience that Glenda Wren and I had. We just went to the National Medical Association, and we did a session with a lot of their doctors, including geriatricians, primary care physicians, whatever. And again, our goal going there was we're going to talk to them about diagnosis and the disease and giving them some national statistics that they would see the urgency and why they need to spend this 10 or 15 minutes that they can now code and get reimbursed for to talk to their patients about it. And we look out, and the questions were not about their patients. It literally was about their family members, how they deal with this issue. They're trying to hold down this job, and they've got a grandmother that they're taking care of. So this is an issue that touches people on so many different levels that I think sometimes our first contact with them has to be to meet their immediate need and make sure that they see that we're actually able to help them with their immediate need before we can ask them to go outside and touch the people that we want them to touch. It's a very interesting issue. I know that, Pam, that you all have embraced, that you've talked about, you don't talk about Alzheimer's disease necessarily very directly. I know that we did a session addressing an issue, but you talk more broadly about cognitive health.
Correct.
Was that intentional?
It was intentional, because you cannot go to the African American community or really any minority community and focus on one disease, because it's not just one disease that's there. Mm-hmm. And so we wanted to make sure that when we were thinking about what would a brain health center tackle, what would be the issues that would make, be relevant to go out and to educate the community on, because so much education is needed in terms of what is Alzheimer's, but also what is Parkinson's, what is traumatic brain injury. And all of those things are, there's major disparities in the African American community around all of those. And then you add in the comorbidities with diabetes and high blood pressure and the list just kind of goes on and on and on. So we wanted to make sure that the Brain Health Center was in line with all of the work of the Bob and Gilead, which really is about saying we want to make sure that we are having healthier communities, that people are living longer, quality lives, rather than just living longer and it's not in a quality state. And so, you know, while we definitely are training with our nurses, focuses on Alzheimer's and focuses on the impact that it's having on caregivers, which, you know, surprisingly to us, we have yet to have a training that there was not one individual who was not personally impacted by Alzheimer's in these trainings. And so, yeah, it was on purpose that we didn't want to solely focus on just one disease state.
Adriana, tell us about the Promotoris model.
Yes. So, I developed and tested a wellness motivation intervention physical activity program that was designed by promotoras in the federally qualified health centers. Now, when I talk about aging, I talk about, I've looked at women 50 and older, not necessarily 65. I think earlier we talked about, especially minorities, aging differently, and especially if these are participants that had certain kinds of jobs, worked in the field. And so I think it's really important to start to not just, you know, focus on 65, but that sort of right, you know, before Medicare patient. And what was great is that this physical activity program, it's a 12-week program, gave the women in this community a voice in intervention development. I mean, I'm a Latina, but the women taught me a lot about, you know, the kind of program that would meet their needs. It had to start at 5 in the morning. That's really early for me, but you know, it really would reflect their values and priorities. Another thing I learned, and I included the picture of the family because all of them wanted to bring grandchildren, and so they didn't just want a program for them. They wanted to include their family, and so earlier, Ms. Shiva, when you were talking, that's exactly what they said. I will do things for my family, not necessarily for me, but I want to be around to do things with them. So including the family, you know, those are things that community health workers taught me as a nurse. And the churches in this community, it's a 5-mile radius community, and there were 13 churches. They identified these as points of pride in the community. While there is a lot of violence and, you know, other things that impact safety, they addressed areas that they felt were a strength and they wanted these to be part of the program, that we would recruit families and women from the program. And then art, I'm so glad that you're talking about art. In this last picture, they encouraged us as a team to think about embedding art in this physical activity program. And what we did is brought a local artist and had focus groups where seniors and their grandchildren would come to the senior centers and design the neighborhood of their future, what they wanted to see in their neighborhood to promote walkability, to promote health. And it was awesome, you know, having them use recycled products and different artwork to create their own art was what they felt they would leave behind for their grandchildren as a legacy. And then the ultimate thing that they did is within that neighborhood, an urban planner helped us put together all of the artwork, and that's a map of this Central City, South Phoenix, where they said these are safe walking places for us. These are places where we can get healthy foods. So all those little items are things that became landmarks in the local city.
So have any of your community engagement activities resulted in you advocating on behalf of the community for change, or whether it's to Congress or the local mayor or, you know, the city planner,
Yes.
to do some things that are different?
Yes, 3 things that earlier somebody asked about the Affordable Care Act. When this study was taking place, the health insurance marketplaces were opening up in Phoenix, and as I, you know, and especially as a nurse practitioner, being someone from the community, would walk the neighborhood with my participants, a lot of the chatter was about the Affordable Care Act. And while I learned 2 things, first is that, you know, we as practitioners tell our patients, you need to walk more, you need to eat better. We need to walk where they walk and understand the issues that impact them. So because of the work that they did, first of all, within the map, we introduced some very reasonable changes that the city of Phoenix can implement in order to improve the neighborhood environmental policies. So we advocated for those changes. And so number 2, in terms of the Affordable Care Act, they really inspired me to look at grants that were being at the time were being promoted. And so the Office of Minority Health, the Partnerships to Increase Coverage and Initiatives grants came out, and I wrote a grant using a small pilot with AARP, teaching families about the Affordable Care Act and encouraging, through grandmothers, families to enroll in health insurance coverage. And it started in Phoenix, but it's now being implemented in 10 states through the National Association of Hispanic Nurses. So again, I think when we do involve the community, you get so much more, especially when it comes to advocacy. So thank you, Alexis.
So we're going to open up now to some questions. But before we close out, which after we do the questions, I want you each to give me one word that you think describes what it is that you do to make yourself present in the communities that you're working in. So are there any questions here that we'd like to ask? Yes.
I have a question, more for advice. So I'm from Jackie with Alzheimer's, Orange County, and we truly have a diverse community in Orange County. We're very fortunate for that. But we have found that diverse communities are hesitant to become an advocate. So what advice do you have for us to get them engaged and know that it's a safe place to be?
So I think, again, Stephanie hit on it a little bit. You have to really think about how you're saying what it is that you're trying to say, the message that you're trying to deliver, and who you're using to deliver that message. A lot of times you have to really think about where those, communities or those individuals, they're already gathered. There's a safe space they already have. So if you can figure out a way how you can get access to that safe space, because that person, that gatekeeper, or that organization, they're going to start to help break down that barrier that you're having in terms of the trust, or them not wanting to perhaps come to a new place that they've never been before, a place that they're not familiar. But if you can identify some place that's already safe, or someone who's a spokesperson who can speak on your behalf to them, that'll at least be able to get you into the door again, to be able to share the information that you're trying to get to them.
And if I can just add one thing, even the National Association of Hispanic Nurses, when they hear advocacy, they think politics. And as nurses, they don't want to get involved in politics. And so I think it's reframing that to, in this case, look at design, sidewalks, street lights. Those are all part of, that's advocating for your community. The health insurance marketplace, educating about that policy. So I think when you start from like those smaller steps and small gains that you can have within advocacy, I think people are more open and understand how advocacy, and then ultimately politics, we want our community to vote, we want our community to be engaged. That's like the ultimate engagement. So I think, but when you start small that way and just help them have those building blocks that help them understand the big picture, I think is helpful.
And I'm just going to add one point to that, and to encourage you to think about it in the same way that we've been talking about clinical trials and clinical research, in terms of the way we respect the participant, the individual. The same thing with advocacy, demystifying what advocacy means, like you said, reframing the question, making sure that if you value that time. And for us, that means when we have advocates coming to DC, we're compensating them for that time, we're covering that travel, we're making sure that they have family care, etc. So it's thinking about the advocacy participation the same way that you would think about research participation, really valuing that individual voice for what they're bringing to the table.
So a question for all of you, but starting with a great big thank you, because all of you have talked about things that can be replicated and are being replicated around the country and at a grassroots and community level, so that's tremendous. Dr. Perez, in particular, I had a question for you about what's going on in Phoenix. I know you've moved on to Philadelphia, but was Mayor Stanton's office directly involved in supporting what you're doing? And if so, do you know, is he taking the initiative to go to the National Conference of Mayors and try to drive replication there. And then I would ask the rest of you similarly if you work with your mayors to try to get replication among their colleagues.
Yes, I don't know if I'm sure he's attending the conference, but in the final meeting that we had with the community, and actually throughout the process of designing the neighborhood, we partnered with the city of Phoenix, and what was a great outcome is that some of the advisory board members became part of his advisory board. And the data that we collected, both through the diagram that we created for the Central City South Phoenix, but then also the stories and the hard data that residents said, we wanted, the things they asked for were not huge things, changing the street lights so that they have more time to walk from here to the senior center. I mean, those are things that do not take a lot, do not cost a lot, and do not take a lot. His office was very happy to get that information. So the residents got to see that by being involved, they could help create change and make an impact, and that local government is interested in their feedback as residents. So yes, and they've been great. They're great. He's a great mayor and he has a great team.
I partnered with Wake Forest Baptist Hospital and the Maya Angelou Center for Health Equity, and we went to the mayor to ask, could he write a letter stating, you, the church, need to understand how Alzheimer's is affecting your congregation in your city. And so that opened up for Lunch and Learns. And so the logistics of the Lunch and Learns, instead of creating an event where only 1 or 2 people show, we asked, what day does your seniors meet? Do they meet? And so we showed up at a day that they were already going to be there, so we were guaranteed an audience. And that has started from 1 church, now we're up to like 8 churches that we go to 4 times a year, because the word I want to use is consistency. No matter what you're doing, if you're walking to a situation that people don't know you, they have to know you're not going to be one and done. So they want to see you more than once a year. Because that first time, you may not get their attention. When you come back and come back and come back, that starts to, you start to infiltrate that circle of trust.
Great segue to that.
I have a question. I belong to a black sorority, and in the black community, sorority is more important after you finish college than it is during college. So it's a big part of the community. And one of the women in the group her mother has Alzheimer's. We are very concerned about how do you frame the fact that African American women tend to have Alzheimer's has a higher prevalence of Alzheimer's, and even the sign outside that says African Americans have twice as much. In this day of the dark web and other things where I read that blacks have IQs of 75 and it's a true fact and all of that, how do we frame that so that it doesn't give credence to other people saying that we're not that bright anyway, so that's why it's so much easier for us to devolve into Alzheimer's? That's a real concern. I don't think people are saying that out loud, and I don't think that the white people who think it are going to say it out loud. But it is a very high-level issue that is very concerning about how we frame this issue in the community.
So I think part of for me, I'm there all the time, so I think step 1 is when I give my talks, I am one of us. So like I am an African American woman, and I'm Dr. Ashley Shaw, which is always like, it sort of breaks that a little bit. And so for the talks that I give, I do lead a little bit with, okay, so we have a higher risk, etc. But and I sort of rest on that, and I'm like, okay, but it's fine, or not that it's fine, but we can move forward from this. All hope is not lost. It's there is a genetic component, but it is not the case that I'm here to say doom and then walk out the room. I think part of addressing that is that much of my talks and information is given to you. Okay, these are the things that you can do right now. Every little bit counts. One thing I like to say is, what I like to say to my participants is, all those things that you've been telling yourself that you're going to do tomorrow, and that you've been holding off, and you're going to eat better, and you're going to start working out. Do those things right now, and they will have, an effect, and I'll even help you do these things. So one thing I did mention with our exercise programs that are held in the everything is open to the public, so that even if for whatever reason someone can't engage in the research because, they may have they may be on a particular medication that, whatever, for like the research details, they can always come into that room regardless of whether they qualify for any reason, and they're encouraged to come back, and once they're part, and if they're, if they give us a way to follow up, we follow up with everyone about all of our services. So while, we do lead with, this is the state of things, it doesn't necessarily have to remain the state of things, and we are here to help. So hopefully that brings people out of this sort of gloom and doom state a little bit, and I think it has.
I also would add that in terms of data, so we know that the numbers are what they are, and I think whether we're talking about Alzheimer's or it's same can be said in terms of HIV. When the rates get so high and it's so disproportionate in one community, it's like, does me highlighting it here offset something that's over here? So I think one thing we have to make sure that, yes, we are being upfront, that we're being honest about what the data is, but I think a good framework to always put that in is making, socially what drives it, economically what drives it, environmentally what drives it, because then those pockets allow you to touch on things such as stigma. It allows you to touch on things such as, socioeconomic factors that are driving all of these, unconscious bias that drives the data, or at least the perception of the data. And so again, I always like to be creative in the data because it is very depressing. But in doing so, really presenting it in a way that allows for that discussion, so that if those things come up, you can address them and kind of talk through them, but definitely move them past that this is horrible into, well, what should we and can we actually do about it?
Sorry, and one other quick point that may also help. So also with our outreach, we update what we talk about with the information that we're gathering. So, last year we did a whole run of outreach programs, with this particular talk. This year's talk will be, okay, so this is how many people who have exercised. This is, these are the results of, our surveys showing this is what people have learned. So even though we may have the overarching statistic, we can at least say, well, this is the good that's happening right now, and you should be a part of it, remain a part of it.
Yeah, I just wanted to add, this actually says from, the importance of community engagement and getting communities involved, because even though we're dealing with average numbers, the twofold, the 1.5-fold, you're gonna have some outliers in that group. So what is really important, and this is why it has to move back, has to connect back to clinical research, which is why the work that you're doing here at UsAgainst Alzheimer's is so important, is that you wanna understand who's at risk, and what kinds of characteristics inform someone who has greater vulnerability. There's a church here in DC that recently celebrated 300-year-old African American women in their congregation who still come to church every Sunday. I want to know what they're doing too. But I also want to know
church every Sunday.
But, and I think it's important to understand we're dealing with aggregate numbers. I'll also share that sometimes this data can be used in unintended ways. I have had folks say, well, we don't really need to look at health disparities. We just think these folks have poor lifestyle, they're not taking care of themselves, they eat a bad diet, and so but that's still part of our responsibility. So, because we're not looking for the ideal person, we're trying to take care and to customize care. I guess we're in this age of precision medicine and personalized medicine, whichever title for it you want to use. But what you really want to do is to try to look at both who's thriving, because you're going to learn some there as well. And I think some of the activities that you're all describing from the community's perspective are some of those protective activities that can inform things. We approve diabetes drugs, and we approve them for use with diet and exercise, but we don't characterize that. You may see something similar with products for Alzheimer's in terms of the other complementary elements, but it's important to look at the totality of it, but also to realize that it's not just about high risk, but you're looking at numbers in the aggregate, because this is population-based data, and to really drill down into what creates that excess risk, what patient characteristics
so we're gonna wrap up this panel. The one word for what you do, what you think is important to be present in a community. Garrett, you already gave us words, but I forgot what it was.
Consistent.
Consistent. Okay.
Availability.
Availability.
I think present and, you know, really present physically and, you know, even when you're away, you're present. I'm not in Phoenix anymore, but I feel like I'm present. I'm committed, yeah.
Yeah, to echo Dr. Perez, it's not in one word, but being fully present, I have to pay attention to not just what I'm being told, but also like actually paying attention when I'm teaching classes. What are the ladies talking about? And you know, and so it's more than just the advisory board saying, well, I think we should talk about this. It's also like, but what are they worried about? What are they watching on TV? Like when I hear them say like, oh, well, did you know that